Hi, my name is Alicia Cajas, and I'm going to talk about epidemiology of acute kidney injury in critically ill children and young adults. Definition: when your kidneys stop working suddenly for a very short period of time, usually 2 days or less, it's called acute kidney injury. AKI is often reversible if it's diagnosed and treated quickly. If you were healthy before your kidneys suddenly failed and you were treated for AKI right away, your kidneys may function normally or almost normally after your AKI is treated. Some people have persistent kidney damage after AKI.
Hello, I am Dr. Ethan Ko, one of the nephrologists at the Vita Kidney Specialists of Fredericksburg. Today I want to discuss the topic of acute kidney injury. So what causes kidneys to be injured or kidney function to drop? You may have heard different terms and descriptions such as acute kidney injury, acute renal failure, acute renal insufficiencies. These all essentially mean the same thing. I also don't want to confuse you with what's known as chronic kidney disease. Simply put, chronic kidney disease is a long-term wear and tear, whereas acute kidney injury is an abrupt injury, such as spraining your ankle. For the purpose of this talk, we'll focus on acute kidney injury or an abrupt, unexpected drop in kidney function. There are many causes of kidney injury. Let's refer to a picture and review from top to bottom. Things that decrease amount of blood delivered to your kidneys may cause stress to your kidneys. A good example of this is if you are dehydrated or have heart disease where the engine is not able to pump enough blood to your filters. Other examples include massive internal bleeding or a system-wide blood-borne infection, commonly referred as septic shock, both of which lowers blood pressure abruptly and dramatically. There are also various agents that are directly toxic to the kidneys, such as antibiotics, chemotherapy, NSAIDs, such as ibuprofen, and contrast or dye material we use on imaging, such as CAT scans and cardiac catheterizations. In some instances, a broken mechanism of your own body's immune system, such as lupus, can attack the kidneys and injure them. So moving lower into the tract, a mechanical blockage in our urinary system that obstructs flow, such as an enlarged prostate or a kidney stone, could cause backflow into your kidneys and cause damage. A good example of this is when you clamp down on your garden hose that is turned on. The result, as you can imagine, is a high pressure backflow causing damage to your main plumbing system or your kidneys. These all cause stress and damage to your kidneys, and regardless of the reason of the injury, can be reflected in your lab work with rising creatinine levels or a decline in estimated GFR levels. In my next video, we will discuss treatment options of AKI. Thank you for taking the time to watch this video.
Applications in medicine. The epidemiology characteristics of children and young adults with acute kidney injury have been described in single-center and retrospective studies. We conducted a multinational prospective study involving patients admitted to pediatric intensive care units to define the incremental risk of death and complications associated with severe acute kidney injury. In Latin America, there's an information gap on epidemiology of the LRA. A search was carried out for articles published in LA referring to AKI, and 61 studies were found, representing 10,670 Latin American patients, in which a distinction is made between adult and pediatric population. AKI acquired in community and hospital acquired, and their etiologies and outcomes are described. Knowledge of the incidence and characteristics of patients with AKI in LA allowed us to develop preventive strategies and better access to appropriate supportive treatment.
There are two major types of acute kidney injury. There's blood flow mediated through things like shock and trauma, and then there's non-blood flow mediated through nephrotoxins such as cisplatin that directly target the tubules of the kidney. my lab's really focused on developing new therapeutics, really interested in looking at cell-based therapies. So at the moment, we've actually been targeting these endothelial cells that are critical for repair after acute kidney injury. And we believe that if we can insert these at the time of injury, that they can potentially be used as a therapeutic for patients to repair after acute kidney injury. The other work we've been doing is looking at mediating critical genes, and one of those that we're looking at is sirtuin-5. So we've actually found that when we knock down sirtuin-5, that this shuttles fatty acid oxidation away from the mitochondria where you produce reactive oxygen species, which is deleterious to the kidney, towards the peroxisome where you don't get ROS production. And this leads to protection. And we're hoping to harness this particular mechanism as a therapeutic that could be used to any patient that is seeing oxidative stress through the proximal tube. Here at the University of Pittsburgh, we've actually been lucky enough to be part of a new NIH initiative where it's the Kidney Precision Medicine Initiative. And this is looking at getting biobanks of acute kidney injury tissue, which there actually currently isn't one of. And we were lucky enough to get one of these proposals. And in the coming 5 years, we will actually be generating a biobank of acute kidney injury samples.
Pros and cons. Pros. Taking good care of your kidneys can help prevent AKI. It's reversible, it is treated immediately. Cons. Not urinating enough, swelling or sweating your legs, ankles, or feet, feeling tired, trouble catching your breath, feeling confused, nausea, chest pain, or pressure.
I am Dr. Vishwanath, consultant nephrologist and HOD nephrology. I am working at Manipal Hospital, Bangalore. Acute renal failure is what is also called as acute kidney injury, because it is called acute kidney injury because most often any injury will recover. So acute kidney failure also will recover. 99% of the times acute renal failure means it is acute renal shutdown, where whatever has caused kidney failure, once it gets better, kidney will improve. The most common causes of acute kidney failure is in an ICU setting where blood pressures are low, they have some infection, where there may be significant involvement of the kidney. Once we treat it appropriately, it will get better. The other most common causes of acute kidney injury are significant blood loss. Somebody has road traffic accident, loses a lot of blood, or they have significant low blood pressure, which may lead to acute kidney failure. As I said, 90 to 99% of the time, acute renal failure, if it is picked up early, treated appropriately, can be definitely prevented. And most often, these individuals, the kidney function gets back to normal, what it was in the original state. Chronic kidney disease is the one where there is a relentless progression. It's a permanent kidney damage and more or less irreversible kidney damage. If we detect it early, definitely we can do something to prevent.
Issue applied in Ecuador. Considering that Ecuador has 16,278.844 source INEC inhabitants, it's estimated that for the 2015 patients with kidney failure will be 11,460. Conclusion. In LA, there's an information gap on the epidemiology of AKI. Knowledge of the incidence and characteristics of patients with AKI in LA will allow the development of preventive strategies and a better access to appropriate supportive treatment. The most causes of AKI in LA, as in developing countries, are preventable, but strategies to improve outcomes and reduce the burden of LRA require both improvements in basic public health, achieved through effective interventions such as a greater access to healthcare, especially for patients with AKI.
Kidney failure can lead to heart failure, and the symptoms of kidney problems aren't always clear-cut. News 13's Jessica Foster looks at the warning signs and advancements in treatment in tonight's Modern Medicine Report.
Kidney failure is a serious condition, but patients can recover and go on to lead a normal life. The key is early detection and treatment.
We get kidneys shut down, we get fluid that builds up, we get those toxins that build up in the body. One of the problems when the toxins build up is it affects our brain, it affects our heart, it affects all organs of the body.
Nephrologist Dr. Todd Minga says kidneys not only remove toxins, but also maintain the fluids we need. He says the best prevention is early recognition of risk factors. Diabetes, high blood pressure, the use of non-steroidal anti-inflammatory drugs, and certain over-the-counter medications can lead to kidney problems.
One of the most important ways that we treat kidney failure that's not amenable to conservative treatment is through dialysis. And most people know dialysis as a chronic treatment outside the hospital. But more importantly for us in the hospital, those people who may suffer from acute kidney injury can receive a life-saving procedure such as dialysis, which is responsible for removing those extra fluids and removing those toxins until the kidneys can recover.
The dialysis machine simulates kidney function.
A kidney has blood vessels, a kidney has a filter, and that process helps remove the toxins in the fluid.
The machine also monitors a patient's heart rate, vital signs, and calculates how much fluid and toxins are removed.
But the goal is not to fix the kidneys with the machine, but to support the body until the kidney function returns.
Dr. Minga says treatment can last for 24 hours to weeks or months, depending on the severity. Symptoms to watch for include swelling, shortness of breath, confusion, and just feeling bad in general. However, the symptoms aren't always clear-cut.
Thank you for watching.